Good morning, everyone. It's Monday, November 22nd. Welcome into the Morning Medical Update. Thank you for joining us here on Facebook and on our YouTube channel. Today, we are talking about COVID and also mental health. For the last 20 months, life has thrown a lot of people a lot of curveballs. And while you may have weathered the storm, not everyone is always happy and peppy. COVID has a lot to do with our frustration and our concerns. So what can you do to make your life a little better and a little happier? We're going to dissect the Happiness Project coming up in just a moment. So make sure you get your questions sent in to us on YouTube, Facebook, Twitter, and right there on the Medical News Network. You can find links to all of those right there on your screen. But first, let's get to Dr. Dana Hawkinson joining us with our numbers. Good Monday morning to you. How you doing?
I'm good. I'm good. Health system is staying fairly stable as far as numbers and active infections. We have 19 active infections right now, with 7 in the ICU and 4 of those on the ventilator. We still have 12 additional patients in that recovery period as well. In 4 of those active infections, 4 of those 19 patients are fully vaccinated. And Hays has 13 active infections and 5 in that recovery period. So again, out west in those rural counties, and Hays, 13 is a lot for that as far as capacity goes for that hospital.
What do you think of those numbers?
They're just, fortunately we hit another plateau. I like that. It didn't continue to go up over the weekend. I was a little nervous as we got into the 20s again last week, but I think nationally we're seeing a 35% increase or thereabouts for the rolling 2-week average. And I think we're also seeing a surge in the northern states, in the Northeast, and in the Mountain West. It's kind of reaching a little bit around, arcing a little bit around us. We'll have to see if it comes back into this area even more fully over the next few weeks. I think the biggest concerns, or what we've heard us say before, was the rules of infection control break down a little bit. Not as much masking in businesses, certainly not in schools, and then people getting together. I think the next 2 months will be the challenge, and to really tell us what's going on. If we can get through the next few months, I think that's a different story. And here's why. Because I think the new pills are going to come out. I think that's going to be a game changer. We got about 1.3 million people a day getting vaccinated. That's a game changer. And if we can continue to trend like that, what we'll see is that COVID will become a much more manageable disease. But I'm looking at the Pfizer pill, the Merck pill, vaccination, as being a critical part, Hawkeye, of that story.
Yeah, and I would add vaccination even for those that have been infected in the past. We continue to get more and more information that even getting at least 1 dose of vaccine will help broaden and strengthen that immune response to any new variants that arise, even variants that you have not seen and we haven't identified yet. The medical literature continues to support that. So.
And I think we have to be wary, and you're watching some areas resume at mask mandates again because of the issues around that. And I think we just have to be thoughtful. And the other thing we have to be careful around is this whole thing about vaccination. And I know that now we may see a special legislative session in Kansas looking at not just the COVID vaccine, but whether we should even have mandates for any vaccination. We're not going to go into the political right or wrong of that. What we are going to do is stay focused on the medical side of this, and just to say, there's no question that things like measles, mumps, rubella, DPT vaccination, those things have saved so many children's lives for so long that just from a pure medical standpoint, this is easy. It may be a different political question of whether or not you can even have a mandate, but I think we ask people to obey the law around stoplights, traffic tickets, parking, how you drive your car, how you conduct yourself in public. It doesn't feel that much of a stretch to try and save millions of lives of children who really can't make informed healthcare choices. And so as a result, we as a society try to make those choices for they and their parents. To me, this is a public health issue. And from a public health perspective, I would just urge as people hear our program to remember that vaccines have been around for so many generations that have saved so many children's lives. Even if your child doesn't die, do you really want your child to have significant brain injury or other health, be compromised of their health around not being able to get vaccinated? Hawkeye, to me, that would be a really terrible outcome from a medical and public health standpoint. Again, I'm not going to talk about the politics, but from a medical and public health standpoint, I think we'd see a lot of injured children who are injured unnecessarily.
Yeah, absolutely, and we know that children can be affected, and The proportion is quite a bit lower than adults. We understand this, but if it's your child or your grandchild or somebody that you know or love, then we know that they can have that risk of multi-system inflammatory disorder, but also have that risk of long COVID as well. And so that is extremely important.
I think if you suspend the vaccine mandates for measles, mumps, and rubella, that is a childhood disease, and
Yeah.
that is going to get a lot worse. And those
Absolutely.
kids are going to be terribly affected.
Yeah, we have decades of proof of how much, and we don't understand this, and I think that's part of the problem is, the age that we've grown up in, that most of us have been alive, don't understand the impact that those diseases had before the vaccines.
And Josh, you might notice we're a little hoarse. I think I may have acted like I was a little younger than I really am at the Chiefs game yesterday.
I was going to give you your 30 seconds to talk about Chiefs.
Okay, let's do it.
Let's do it.
Great win yesterday. All about that defense. This is a championship defense right now. They're on a roll. They shut down a good offense, even minus a couple of receivers. Got to like what we saw yesterday. I'm a little hoarse from being in the parking lot for 2 hours before the game, 3 hours before the game, and perhaps a little hoarse from the game itself.
So you're lots of screaming.
Yeah, but it was all worth it, and it was all outside,
Yep.
and there's just no outbreak coming from the parking lot or the stadium, and there were a lot of wind last night. So, man, I think we're all safe, Hawkeye. I think we did the right
I
thing,
would agree.
and we've clearly made a difference. Too many Cowboy fans in the stands, though.
Were there a lot?
Oh, don't sell your tickets to people with Dallas zip codes. Just not the right idea.
But we should also mention that outdoors things. We know Sporting won.
Sporting was great,
And of course,
3-1.
Rockers
That's a big
won boys soccer championship.
Our
You're a little
soccer guys are
biased
here.
about that.
Well,
Well,
so-
he's a rock. Aren't you a
But
Rockers
all those
Yeah.
activities are outdoors, and I think those are safe. We certainly have been able to say that those types of situations are definitely lower risk than.
Hey, can we just say about Royals baseball for just a minute? I know we're all homers here, and we'll shut up.
Let me see. Hold on. You're past your 30 seconds.
I know, but come
I'll
on.
take it back
We have
later.
the best young arms, and we have the best young infield that's coming in baseball. We are going to be, in 2 years, Royals win the World Series.
You said it.
There
You
it
heard it
is.
here.
Right,
Dr.
there it is.
Nawalanic,
That's
good morning.
Morning.
How are you? We've
I'm just
seen
enjoying
you.
watching.
Come on,
I
let's
just
talk
want,
about
I
Royals
know.
and Chiefs.
I see you. We've been seeing you on the screen. So good morning to you, by the way. How are
Thanks.
you?
I'm great. Good morning.
Lots to
everybody.
talk to you about today.
Great. Cool. Let's do that.
Hey, do you want to talk about the Browns?
Oh,
I mean, I love them. They're breaking my heart again. I think I probably really need to look more at the Chiefs.
are you a diehard Browns fan?
I am diehard, dyed in the wool. I've got issues. Deeply affected by my affiliation for years.
Did you grow
So
up there?
I grew up in Central Ohio. My parents are both from Cleveland area, so I inherited this
Okay.
affliction.
Fair enough.
The Chiefs have the same affliction,
Dog
and
pound.
it was untreatable until Patrick Mahomes came.
Right.
Patrick
And-
Mahomes cured Chiefs' affliction, sort
So
of.
is he allowed to stay on the desk with us today?
Yeah, I
even,
suppose.
even with what we've learned.
He did confess to trying to dance with the Chiefs a little bit. So we're
Okay,
giving a little bit of
he's
a break.
dabbling in the
Yeah.
Chiefs.
I mean,
Love
look,
it.
both have been afflicted franchises for years. So when the Chiefs started
Yeah,
to
but
make
we're
right,
doing
it was like,
good, so
okay,
we get to say that. That's how we roll.
That's-
You know it.
all for it. Happy for you guys. Love it.
There's a
Feel great.
common theme here. You got a Tom Brady, you get Aaron Rodgers, you get Patrick Mahomes, and that's a game changer. For my friends who were with us yesterday from Denver, I tell them now that we beat the Broncos, you're getting Elwayed. Because, how many times did we get Elwayed?
yeah.
Now,
Elwayed.
you're
Oh,
getting
yeah, I
Mahomes.
can't
That's
handle
great.
Elwayed.
Mahomes
It's
and
great.
Elwayed.
Getting
I
Mahomes
like
and
it.
Elway's. Yeah, they're verbs.
They're real things.
Yeah,
Verbs.
that's an actual term. Okay, let's get to our reporter questions. Any on the line today? None. Okay. So we're going to get to our conversation. Again, get those questions sent in. We'll get to our community questions here in just a minute. But the number of people satisfied with their personal lives is down 8%. A Gallup poll finds that 82% of Americans say that they are happy with the state of their personal lives. That seems high to me. That's down. That sounds pretty good. But that's down from 90% in 2020. That's even more surprising. So the latest findings mark the lowest level of satisfaction measured by Gallup since 2013. So what can you do to put a little sunshine back in your life? Of course, we've got Dr. Greg Nawalnick here. He's got all the answers. Clinical Director of Psychiatry and Behavioral Health here at the Health System. Joins us in studio. Glad to have you.
Glad to be here.
You're going to give us all the warm and fuzzies today, and you're going to help
Oh.
us head into this holiday week with our families, a good state of mind. heading
Yeah.
into the new year.
I got to say that those numbers did seem a little elevated. I mean, maybe that's just from where I'm sitting.
Okay, 'cause you're in the thick of it every day.
You wonder who did the Gallup poll actually survey on that discussion?
I was just going to
Because
say,
it's just-
anybody who knows how research works is going to look at this and wonder who's the sample. Because
Right.
90% down to 82% of whom? Because
Of happy people?
Yeah.
Apparently, yeah. I mean,
Right.
It does feel a little high compared to where I think America is in the pandemic and what you read. I mean, you look at the mental health calls we have, the number of children and the impact on schools and high schools and college. I mean, there's just, I'm a little suspicious.
90%
of the
in
number.
2020. That's
We're a little suspicious.
Yeah.
good
No.
for you. Okay, so
Really.
you mentioned at Dr. Sites, but what do you think is, because again, you deal with this on the daily, so what do you think is the major distress right now?
I think obviously it's going to be the pandemic is first and foremost. Beyond that, I think I will get back on my soapbox as I always do, looking at the influence of social media. This has an immense potential to bring people together, but unfortunately, it has an equally potent potential to shift people in really nasty arguments against one another, to reflect inaccuracies and really magnify any of the self-esteem things, the insecurities that we have, because we're just inherently comparing ourselves to whatever we see out there. And when we see all these perfect bodied, like sun-kissed, taking trips everywhere, and then we look at our life, like
Wah, wah.
the comparison is not the most favorable. And so that, you used to have the one person in your office that would go take the trip and come back, and you'd see them all aglow, be like, yeah, it's great, good for you. Now that's all you see if you're on a feed following a bunch of people. So it's created this unfair and unrealistic comparison, and I think that really adds to taking away and robbing us of our present and our actual life and daily existence.
All right, let's get down to business because you're going to kind of help us. I want to talk about 3 good things, a 3 good things exercise. So tell us just what that is and how it can help us.
So what the 3 good things is this exercise that was developed, and it's out there as part of this, I think it's a happiness project or something it's called. And it basically looks at the end of every day, you sit down and reflect and think of 3 good things from the day. It can be anything. It could be something that you did, something that happened, something you saw in the news, anything that's positive, something good. And so what you do is you write it down in a journal, and then you sit and kind of reflect on it. You think, how did these good things happen? If it was something that you personally had done during the day, you can think about what was the course of action? What did you do that actually made this occur? So it's really, the idea here is just an old school throw to positive psychology, which there's a lot of research out there that the more positive that we are, we can see more good in our lives. We have a little more optimism. We have an increase in hope. And these are things that, if you're a Star Wars fan, you know that hope apparently can topple empire. So it's all about hope and trying to be positive and finding the good things.
So let's
It can
talk.
also topic pandemics, right? It can topple pandemic because we say faith, hope, and science are the things that deliver us out of the darkness, and I think that's really been true in this pandemic, because as much as we want to say we're going to fight with each other about mask mandates, the reality is that the way out of the science isn't fighting with each other or out of the pandemic. It's really getting vaccinated, using some of these new things that are about to come out in terms of oral pills, and then following the rules of infection control. That's what's taken us out of the greatest, darkest days in the midst of this pandemic.
Yeah.
Let's talk about positive psychology. What do you talk to your patients about? What do you tell them to do? You kind of have, like I call it, the Nawalanic method.
Well, so number one, when I'm dealing with a patient that has depression, the biggest thing that we want to target is shifting away from passive avoidance to active engagement in their life. And what that looks like is, if anybody here has ever had a really rough day, something that they really didn't want to go and face, and they hit the snooze a couple more times, and maybe they wind up sleeping through the alarm, don't wake up in time, and they miss whatever it was, they wake up to a bunch of voicemails, they feel awful, and they just go back to sleep. That going back to sleep and waking up later after business hours, you're like, oh, nobody cares anymore. I got away from it. Cool. The problem is, in that passive avoidance, now the problem still exists. It's even compounded. So what we want to shift to is this idea of active engagement, where you're more positive, you're more, you're better off going and facing the fire, go deal with whatever the situation is, rather than avoid it, because as I've said since the pandemic started around anxiety, what we resist persists, and it's going to come out in other ways. It's going to grow. And when we're dealing with depression feeds on passivity, when we're trying to just avoid things. It's like a lens that we see the world through. So when we're feeding it active engagement and when we're feeding it positive reflection, when we're looking at anything that we're grateful for, these are the things that depression just like cringes and cowers away. And the other piece, going kind of along with what Dr. Stites was just saying, social media really does try to, at a large level, divide us. But if we look, our interactions day to day are one-on-one, over and over and over again. And so you have a choice. You can either buy into the noise at the upper level, or you can actually try to be the positive change that you want to see in those one-on-one interactions. And that's how change occurs. It's individual. So
I want to ask about intentional. That's a word you use a lot. So as we go through your 5 things that you tell us, so can we talk just specifically about when you mean intentional, what do you mean by that? And just how can we use that in like small little ways?
Well, intentional is just about being actually present and mindfully engaged. I think, so if we go through the 5 things, the first one starts off with a daily meditation in the morning, in that kind of groggy period where you first wake up, you're not going to be doing a whole lot. Taking a few deep breaths where you breathe in, hold it for a 4 or 5 count, slowly exhale. Do 2 or 3 of those. Obviously only breathe as you have to, so you're not forcing yourself to take these deep breaths over and over, because then you start to get dizzy. But as you get to a calm mind, and you can set an alarm for 10 or 15 minutes, whatever you have time for, so you're not worried about, did I do it long enough? And try to identify a positive intention for your day. So you can think of anything like, I'd like to be more mindful, I'd like to be more engaged, I'd like to be forgiving, I would like to be more loving, I'd like to be more caring, I'd like to be more open. See, it's very easy. They just roll off. But it has to be positive, something that you would be adding to your day. And kind of, as you're continuing to breathe, think about how that might look in your day. Just imagine through it. And then when your alarm goes off, one more good deep breath, and then go about your day. The next step to get at that intentional piece is when we go to work, so many of us just forget why we're there. We're kind of going through the motions. And what we want to do is, even if it's just for 1 hour of every workday, and you can break it up in little bits and pieces, really engage. And remember, why are you there doing what you're doing? For some people who have just a regular job, you're there to, just a job that you're working, you're there for income. You're there to provide for yourself, loved ones, whatever it might be. If you're somebody who has like a career that you went to schooling for to get to, remind yourself that there was a time at which this was your goal, and you are actually in your goal and living that moment. This is the vision you had for yourself. So even having a little bit of congratulatory experience where you're like, hey, you made it, like, let's do this thing. And remember what it was like from the outside looking in, because sometimes when we get in, we get mired down in the culture sometimes of a job where everybody says, hey, how's it going? Well, I'm here, and that kind of stuff. It's just not helpful, and it really will feed depression. And so the more that you can actively engage, really get the work done, you're going to feel better.
I love that. You do hear that a lot about, well, I'm here.
Yeah.
That's not right? You
Right,
really
yeah.
want people to
Living the dream.
Yeah.
Sometimes a dream's a nightmare. I mean, these are the things we say, and we don't think about the language we use with ourselves. And the one person who hears everything you say in a day is you.
Is your head. I can't, this next one, your third one, is about putting down the devices. And I cannot imagine how much help that really does. We're so used to doing it. Yeah. So just tell us what kind of impact that could have on somebody.
Well, if you think about it, back in the day, you went to work, and then you left work and went home. There was no email. Maybe if there was an emergency, you got a phone call. But now we have this expectation. We're still paid for a 8-hour workday, but yet the phone comes with us, email's there, and a lot of us who have a strong work ethic just keep checking the email and keep responding.
You could do what Dr. Stites did to me today. He just put me to voicemail when I tried to call you.
Yeah.
Excellent boundaries.
See,
I knew where I was. I was walking down here.
He saw me
But
calling.
I'm
He's
not
like,
very
I'm
good
on
at
my
the
way.
boundary thing. I'll tell you what, I've tried to.
Are you good at that?
No,
You're chief medical officer. You get tons of calls.
I do, and I'm telling. I mean, I tend to work. I don't tend to leave till about 7:30 or 8 at night. I tend to go home, eat some dinner, hang out for a little bit, look at my phone a little bit during dinner, and then I work again for another hour or two at night. I'm trying to do better because I think as you get older, especially, your stamina is not quite what it was. But I also think that affects your personal life if you don't do exactly as you said. And so we have this rule for dinner. We try to put your phones down, no touching the phone. And sometimes it works better than others. But I'm with you. It does. It's hard because you could work 24/7. There's always something to respond to.
Always. And so the idea here is that after you've gone to work and you've put in your time and really done work that day, leave it there. If there's an emergency, believe me, someone will call you. They're not going to send an email for an emergency situation. But the point is that when you get home, whether it be your spouse, your kids, your pets, yourself, whatever it is, put the device away. I don't know if you need a lockbox, put it in a cabinet, put it in the car, wherever it is, that you can't get to it for at least an hour. And really mindfully engage with the people for whom you work, the people who are supposed to enrich your life. And the realistic reason that they're probably not as enriching as they might have been before is that we're giving so much to work that we're just not present, we're not engaged with them. They almost become another job, something else we've got to do. And again, remember, it's really helpful to pull back and remember the time when you didn't have them. Think back to when you first started dating your partner, whoever it was, and you were so excited, like you would check the phone, the damn phone, that you kept looking. Are they going to call? Did they text? Oh my gosh. They're still that person. They're still the person that you want to be with. And if you guys have drifted apart because of a lack of engagement, lack of doing stuff, this is a way to find each other again. And with your kids, think back to the fact that, when you were young and you might have wanted to have time with your parent, you either got it or you didn't. And if you got it, think about how that made you feel and think that this is a gift that you can give your children. And if you didn't get it, think how deeply you needed it and wanted it, and that this is something you can provide. So this is about active, mindful, purposeful engagement in the things we do. We're not going through the motions. We're not phoning it in. We're actually really doing the stuff that's going to make us feel better.
And I won't get you started on the brain-rotting social media scrolls that you so much love, but
we all fall victim at times. Like I was talking to my wife about this last night. She's like, so how many of these things do you do? I was like, well, I do a lot of them. I was like, you just don't see them. And she's like, well, I see you with your phone. I was like, well, that does happen. Yeah, I have my moments, and it's
But
Especially
to
during the
Jessica's
Chase game.
point, these are not opinions. I mean, there's data to support that these
Right.
are, directed and conscious efforts made by these social media companies to do this as well, and how much irrevocable harm these things are causing.
yeah, long term.
And one of the best tips that I saw, and I think it was the documentary, The Social Network, where the folks who created the technologies behind social media are kind of coming clean about, well, we didn't see it going this way, which, okay. But now that it's been monetized, they said the best advice they can give is turn off notifications. Because if you want to choose to pick up your phone and use it, go ahead. When your phone as a device is reaching out to you and saying, hey, come on, look at me, that's a problem. I mean, that is literally the technology driving you instead of you using it for the purposes that you choose when you choose.
Do you ever think that at some point the technology that affects you like that is a little bit like the drug scourge, right?
Absolutely.
We had to fight back against cocaine or heroin or whatever, and now I think we're going to have to fight back against this intrusion. And I think we have to call it for what it is, and it really is. It is yet another epidemic we are dealing with, and it's the social intrusion epidemic.
Well, and if you think about it, look at how harshly that our society would go after a drug dealer, right? Someone that's around the schools trying to sell the drugs. Yet we have no problem with social media companies. They're not regulated at all. There's no penalty for anything that they put out there that's inaccurate
But
or
it's
false.
addictive, much like
it's
a drug
horribly
is.
addictive. Yes.
You
They
look
can
at what
get to our
happened
kids.
with Purdue
It's-
Pharmaceuticals and what happened with the opioid crisis. We have to look at social media as really people who are driven by profit, making choices we know are bad.
It's like
Yeah,
changing society and the way we
You
think.
just can't do that.
It's habit forming like a Las Vegas slot machine. Even if you look at the method it uses to refresh, pull down, wait, whoop, just like pulling a slot machine lever. I mean, it's
And there's so much false news and so much, and it's really directed towards making you angry or making you addicted. And those are both bad emotions, right? I'm going to make you
Absolutely.
angry, and I'm going to make you addicted. And so I got off Facebook for a reason, and it was because after the 2016 election, whether you're Republican or Democrat, the news on there was just wrong. It was just a lie, and simply just say, well, I don't want to surround myself with a culture of lies, so I have to move beyond that and try to figure out a way to have more balance in
So
my
you're
life.
a recovering Facebook addict.
Yeah, I'm way past recovering. I just don't do it.
You did good.
And it's an ingenious tool of manipulation, because the more angry that we get, our ability to critically assess fine details of arguments goes right out the window. We come back to our midbrain, which is that mammalian animal brain, that's just emotional reaction. We lose what makes us human, that prefrontal cortical ability, which is where we have executive function, attention control, the ability to fine-tune decision making. All that goes out the window when we get mad. So there's a perfect, ingenious mechanism underlying this whole thing, that the more they can keep us mad, whether it's true, false, whatever, mad, we keep coming back and looking, and we're not willing to listen to anything the other side has to say. And that's the most concerning part, because
And then they monetize it, so they're trying to
Sure.
make more and more money off of you. They're really not trying to present a political viewpoint to you. They're trying to put a profit, a way of making money off of your anger.
They just
and,
want you
and you
clicking.
have to step back and say, oh, there may be something wrong with that.
yeah.
But you got to get off of the stuff.
Yeah,
Well,
and send a message to those companies. And the hard part is, it really is fun to connect socially with people you haven't seen in a while. Those are the good things. There's some really good
there
parts of
are.
it.
I say there are
But it's when
positives.
if you monetize the anger, which I feel like that's what we're seeing, and you see with the congressional hearings, it's like, come on, guys, you just have to be a better person than that.
Two more things you tell your patients, because I'm getting some good questions on topic today, and I want to get to those. But just touch again on intentional. You said intentionally grateful. That's a good week to talk about that.
So also along the lines, kind of with the three good things, is finding something to be grateful for in the day, even at least one thing that didn't go horribly. Sometimes it starts at that level. Like, you literally just have to think, like, what didn't crash and burn today? That's your positive. But trying to identify at least one, however many positive things that you can reflect and find in your day, that's great. But at least one. And sometimes that one is just, I got up, I went through my day, I'm still here. That's a positive. Be grateful for that.
I lived another day.
Yeah.
Yep. Thank you. And then you said about 10 to 15 minutes of meditation, or just kind of bookend the day with positivity.
Exactly. So you're starting the morning by setting that positive intention. At the end of the day, when you're lying down to go to bed, this is something that will help not just with this overall feeling better, but also with your sleep. Turn off all the screens. Take 10 to 15 minutes. I mean, obviously you have to use your screen if you're setting a timer, but set a timer, do your deep breathing again. And now at the end of the day, recall that positive intention that you set and reflect on it and try to think, did I do this even once today? If you didn't, the reason that we set a positive intention is that instead of a negative would be like, I don't want to snap at somebody. I don't want to do this. I don't want to drink. I don't want to, whatever. I don't want to do social media. If we set a negative like that, something we don't want to do, and then we do it, now we're a failure and we can kick ourselves. If it's something positive that we're trying to add, if we don't do it, at least just by adding that intention, we did something positive, and maybe if we didn't do it today, it's something we can do another day. But the point is, even if you did it just one time in the day, you're literally going to bed a better version of yourself than you were the day before. And while at one day that's not going to seem like a huge difference, think about the power of 3 to 6 months of that and what that can look like in terms of really investing actively in improving yourself. Because if you're not going to do it, who is? And you're the greatest gift that you have for yourself, so use that, work with that.
Jess, I think one of the keys to this whole conversation a little bit is we actually have another public health crisis. We've talked about social media, but the other one is sleep. Mm-hmm. We have so interrupted our sleep cycle in modern society that we've looked at sleep almost, it feels like as an annoyance. It's like something I have to have, where actually sleep is really meant, it's very biologic. It's when your body physiologically and biologically needs that time to rest and then to reset itself. It helps your immunity, it helps your health, it helps your mood. And when you are attached to social media 24/7, especially right up time you go to bed, your brain is still awake even when you're trying to go to sleep. So we're not trying to turn you into Buddha, to your point about meditation. We're just trying to help you get a proper and restorative sleep, which will put you in a better mood and less depression, less anger, less anxiety. When you don't sleep, all of those things are multiplied. And I remember one time, sleep apnea is another manifestation of what I was saying. And this patient had terrible sleep apnea, and they were a school bus driver actually, and was having trouble staying awake, couldn't drive, couldn't earn an income for the family, and was in a really bad mood all the time. So we did a sleep study. They got 4 hours of good sleep with a CPAP machine. And his wife called us back and said, this is the husband. I haven't had him in 10 years. I want him back like that. I need that sleep device right now. And the story is of the restoration that occurred. And there's many ways to have interrupted sleep. And that's one of my wife says, you're so much better after you go down to the river. Well, the reality is I go down to the river, I go to sleep, and I'm disconnected because there's no
signal.
There's no signal anywhere.
We're not
and
bothering
it's
you.
just, it's a totally different world, and you just have a better
I'm
mood.
glad you brought that up. It all comes back down to the health. Yeah. And doing the
does.
things that you can
It really
do to
does.
control how you feel physically, mentally, emotionally. Let's get to some community questions. We've got some good ones, but I do need to get this one out of the way. Jean has a question. Dr. Seitz, if you can answer. Just your thoughts on Dr. Lee Norman stepping down from his post.
Yeah, I think just Lee's a good friend. Lee held this position before I did as a chief
Yeah.
medical officer, and he'd been on this program for a long time, and I think the world of him, and I thought he did a wonderful job trying to help keep Kansans safe during this pandemic, and I'm sure Governor Kelly has some good folks in line, but I'll just say I felt like he really helped our public discourse and help support the important rules about infection control, getting people vaccinated and doing things like that. I know there's always politics out there, but from just a pure public health standpoint, he really was helpful. And I think that honest discourse is important. When we have our chief medical officer calls here in our community, we're trying to be honest and take care of each other, and I think Lee tried to take care of us. And I'll miss him in that role, but I won't miss him as a friend. I'll find him and we'll go do something. I'll run him down somehow.
You will. I bet you
Yeah,
will.
yeah.
All right.
Good
Thanks
man.
for those
Very good man.
comments. Melissa has a good question, and I'm going to piggyback on it too, if I may. So Melissa says, our phone, also we use it for leisure. I might want to learn how to paint or craft, or I might be researching different things and actually getting some good things and information from it. So how do you not answer those work emails and texts when you're just picking it up for maybe some good positive things?
So this comes down to a big word that to a lot of people is a 4-letter word: boundaries. When I promise that the answer for your crafting, your art, whatever your self-enriching experience that you're going to use your device for, doesn't go through your work email. So I know it's a tendency, and unfortunately we are kind of creatures of habit.
Your thumb hits that button, you know it
just,
does.
you figure, I got it up, let me just check.
Yeah.
But this is about what you're describing, I love the use of the device for something that's personally enriching, something that's engaging, something that's going to really help you. That's why we applaud the devices. It's that the challenge is on you to recognize that urge. And if you choose to indulge it, know that you're making a choice to rob yourself of time. So let's not do that. Let's continue the course of what you're doing to work on yourself, to engage yourself, and avoid that button. I promise you're going to feel better.
I fear that day when we all look back and go, gosh, how much time did I waste scrolling and clicking and looking at stuff that just doesn't matter. It's a stealer. It robs you of time, quality time.
Which time is a thief already.
It is.
So now
It is
we're
thief.
robbing from the thief, which is robbing from us.
Exactly.
Like, come on.
And Dr. Seitz, you could jump in on this too. Catherine says, how do you suggest staying informed when bad news sells and TV newscasts are bleak and social media is what it is, as you've said, is what it is?
And Jess, this is your area. What do you think?
I'm telling you, I know. And that is tough. That is tough because now you can get your news anywhere. And so, you're right. It's always, I was in television news for so long and it the stories sounded the same and bad news sells and it is tough because that hasn't really gone away. It's just now available in many, many other spots and locations.
And you can find it. I think it's here's what I believe. I believe we're not going to stop that bad news sells. It's going to sell. So, TV broadcasts have shown us that. If you read American history, we think about how awful people treat each other and things they said about it. You should see what they were saying back in the Revolutionary times. Go read some of the things Alexander Hamilton wrote about Thomas Jefferson. Jefferson wrote about Hamilton. There's some pretty tough words out there. And but I think what the problem with the internet and with national media is it has made untruths rapidly and repeatedly and excessively accessible all the time. And there's this escalation phase. And I think the first thing we have to, just as we did with drug crises and other addictive things, right? We have to start with a really honest conversation and a lot of public service discussions about what is this? Let's treat this as the epidemic that it is. And we're all talking about epidemics and pandemics and blah, blah, blah. Nobody wants to hear those words. But the reality is that just as there's been a drug scourge, and actually one I just was reading about last night was the impact of fentanyl now in drugs and what an impact that's having on things. And we need to have a national conversation about that. We had to have a national conversation about the opioid crisis. We probably have to have a national conversation about truth in social media. The one difference is that even with a news organization, there is some fact checking involved. There is some, you can't just go out and say anything you want. That's not true in social media.
Right.
And I think there's a step over the line, and I would even go as far to say as I'm a little concerned sometimes that national news media, I'd like to hear your comments about this, have maybe not been as fact-checked as they once were either, that even those standards have
It's coming
loosened.
fast and furious. It's hard to
Yeah.
do. And I think social media makes us lazy. You're right. You just flip through it. You take it for face value. There's
Yeah.
no digging deeper. There's no doing more research and finding out more information about that and asking the question, wait, is that really true? It's just you take it for what it is and walk out.
And as a former journalism student, rule number one, Al Prince, I'll never forget him teaching me, if it bleeds, it leads. That's your traditional mainstream media. So when you move into online outlets
Or anything goes.
where all you have to do is have a nice headmast at the top of your website, put news somewhere in there, you now just became a credible news source by online terms. And the vetting, the fact checking, it doesn't exist at all. And the problem is that whereas back when we were coming up, if you saw the news and it hurt your feelings, made you feel bad, you had to sit with that. And you had to be like, wow, that's a tough deal. I don't really love what's going on. Now, if you don't like the news, you can go online and search for what you want it to be, and you'll most likely find some outlet that will reflect. And that's where we have an inability. The most concerning thing that I'm seeing about the politicization of things is we used to be able to have meaningful discourse. Obviously, Dems didn't agree with Republicans. It was just, they were never see eye to eye. But you might be able to at least have a meaningful conversation. You could get along and realize, all right, let's agree, disagree, maybe find one point that you agree on. You say, all right, let's just go with that and we're done. That doesn't really exist now. It's upsetting to watch people try to talk. As soon as they learn what side you're on, it's an immediate attack. And the fact that someone else's view, we've lost the idea of coming back to say, you know what, their views are this way because this is what they feel is the best way for things to go. It might not be mine, but they don't want to tear the nation apart. It's just a different perspective. Now we've gotten to a place where each side just says, they're going to ruin the nation, they're going to tear it apart. I assure you, we've been through worse, we've been worse. This isn't at all true, but it's, again, let's keep us angry, let's keep us off balance, and it's concerning.
Got a couple of questions about this. Susan is asking, wondering if you could talk about retired folks who do not work, especially those who are high risk, live with someone who's high risk or live alone. How do they feel comfortable, safe, re-engaging with the outside world after being isolated so long? Just helping them get to a place where just doing small things, volunteering, lunch with a friend, doing it safely, but it's mentally, it's a mental place that they've got to get to.
I think that everybody, this isn't limited to just people who were, have health issues, have been kind of separated. Everybody had a certain amount of social awkwardness coming back out in the world. And so this really comes from just giving yourself grace, recognizing this is a process, volunteering, great. Doing stuff with animals, everybody's always happy with animals, having fun with rescue, adopting pets and stuff. No, you never see anybody really, really aggressively mad around rescue pets, So, what's
A puppy.
a puppy, yeah.
Cuteness overload.
So these are the things that can get you out, and it takes some of the pressure off of the individual and puts, a little more focus on the activity or whatever it is, so they don't feel as much social anxiety.
But that might be easier for somebody like myself. But, Joellen's asking, what about people who are retired or live alone? They don't have access to
Yeah, but
that.
I think, so let's first of all step back and say, I think we have to make people feel safe to do it. And in Hawkeye, I think the evidence is pretty good that the vaccinations do help in the elderly. We aren't seeing the scourge coming out of nursing homes that we saw earlier in the pandemic, and that's one of the most vulnerable populations. what we know is that if you've been fully vaccinated and you wear a mask, you can get out in just about any public forum you want inside. And if you're outside, you're going to do some outside activities, you can really do just about anything you want. And I think even if you just follow the rules, you can really be safe even when you're in your 60s, 70s. Oh, wait, I'm in my 60s, 70s, and 80s, and 90s. And I think that we know that isolation is so bad for our health that if we do a risk-benefit analysis, it's a little more risky to go out there and start doing things even when you're in your 70s and 80s and 90s in this pandemic. Yeah, it is a little riskier, but what's the mental health risk to you on the other hand, and how miserable do you want to be? And I think, again, if you've been fully vaccinated, especially in January when the Pfizer pills come out, trust me that that's all going to look as good as we think it is. I think you just have to shift your risk tolerance a little bit and believe that it's okay to get back out there.
Yeah, absolutely. I mean, from the medical standpoint, we know, be fully vaccinated. If you are 65 and above and you're 6 months out, make sure you have that booster. We know the data is good to support the fact that it helps protect you from hospitalization, severe disease, and death even more. And so that's the medical standpoint. Personally, I've dealt with this. It was my grandma who died recently, and it wasn't because of COVID. Her facility was great about it. She was vaccinated. It was that isolation. And so it really taking that risk to understand how much can you tolerate or what is your anxiety to be able to get back and start to function a little bit in society. It is difficult if you are at high risk, obviously, but you can start to have those conversations to try and do that and get away from that isolation.
And Greg, I think it starts with this concept of you are safe now. Let's start from that premise and think, how do I re-engage?
Yeah, and the other piece of that is that I think if you're looking, let's say, volunteering through a reputable organization, they're going to have safeguards in place. You're going to be welcome to wear a mask if you choose. I mean, they're not going to tell you, no, don't wear the mask. So you can take the pillars of infectious disease control with you to do these things and just make the best choices for you so you feel safe.
Yeah, and I think it's important to realize that if you see somebody wearing a mask, it's not a political statement. I advise a couple of companies and groups and boards around town, and they said, some of our members don't want our employees to ever, or people, our guests don't ever want to have our employees wear masks. And I'm like, yeah, you can't make that decision for someone else. You have to respect their own individual autonomy to wear masks because you don't know why they're wearing a mask. Transplant patients have been wearing masks forever because they have to. Yeah. And we tell the CF patients, don't you dare not wear a mask when you get out there amongst a lot of people. You don't want to pick out a lot of disease. But so I think that there are a lot of people who've been wearing masks for a long time. And I think if you feel vulnerable, you should try and take care of yourself.
I have just a few more questions, and I just have to read Kathy. I love this gal. She says, I'm 65, vaxxed and boosted. She cares for her 93-year-old mom who has some cardiac issues. She masks indoors, but she says, I love to sing. So does this guy, right? Choir is her therapy, she says.
My singing is nobody else's therapy.
No, it's not. It sends me to therapy.
Yes,
your
does.
singing does. But I just feel for her. She says choir is her therapy. So I'm sure these are the things you're talking about, finding those things that you love and connects you. She wants to participate in her high school reunion, her Christmas sing-along. She says, I watch church online so that I can sing out loud with no mask. So I'm just envisioning her at home singing her lungs off, and I love that. But she's like, just put my mind at ease. She just wants to, know that she's doing it right.
Hawkeye, your thoughts on I want to follow, but I'm going to give a couple examples. So,
yeah, I mean, I think it goes back to, again, what are those groups that you're singing with? Are they having safeguards in place? We know it's obviously more difficult to sing with the mask, but I think you have to do what you can to protect yourself as much as possible, and that is getting fully vaccinated. And then taking that risk and understanding what is the risk and judging that for you to try and get back out to do those things, because those things do add to your quality of life. And so I think that is important.
And I think, again, it's about the choices you make and the risk level you want to accept. So, is singing in a choir fully safe? Nope, not fully safe.
No.
Are there great ways to make it safer? Can you get a little bit further apart? Is everybody's fully vaccinated and boosted? You know what? That changes the story a whole lot. Because even if somebody's sick, you're not going to die. If you talk about a number of people who are vaccinated that are positive, and our positive case numbers, we said it was like 20% or whatever this morning it was. But if you peel that back, you'll find a lot of those people are coming in for asymptomatic, and it's an incidental finding. Right. Or we find that if you look at the number of deaths, it's 12 times greater in those who are not vaccinated versus those who are. So if fully vaccinated, the rules, and you're relatively healthy, you're not going to die from COVID-19. I mean, that we can't give you the 100% guarantee, but we can tell you the odds are really in your favor. Yeah. And if that's who you are and you want to go out and sing and your choir is fully vaccinated, I'm like, I think you probably ought to go out and sing. But I think that's one of those decisions individuals make. So our church, we have a smaller choir right now because of COVID-19. The choir members are still masked, so they sing, but they're well mic'd, and they sound really good. And I think that you can make small changes in life to try and cope with what it is. But I think if you're fully vaccinated and you try to stay healthy in all your other realms, I think you can take on a little bit more risk. I would also say to you, and we have to wait and see with the evidence, but these new oral medications, if they're as good as they're saying they are, that's going to change the calculus even further.
Okay, on that, I'm going to ask, I've got two questions, but I'm going to ask this question first because you just mentioned it. Jennifer says her husband is a bone marrow transplant patient. They have 4 kids, 2 in college, 2 in high school. Everybody's boosted, who's eligible, vaccinated. But she says, we have come to realize that we cannot rely on our community to reach a vaccination rate that will make us safe, make it safe for my husband to rejoin the outside world. With mask mandates slowly leaving, this peels back more layers on protection. We're now placing our hopes on COVID treatments that will be coming out. Will the new Pfizer pill be a good COVID treatment for transplant patients?
Yeah, I don't know we've got enough evidence on that. We only have the company's announcement. We haven't seen the data yet in public, and we haven't seen it in subgroups. What we know is that the Data Safety Monitoring Board, which is a bunch of independent folks who monitor research studies, looked at the data on the Pfizer study and stopped the study because it was so good. They didn't feel it was ethical to put people into a placebo arm. So as a result, that's now in front of the FDA. I believe they submitted for the early use authorization now, and if that, I think that'll be a remarkable deal. Hawkeye, I don't think we know enough about specific subgroups and that. We just haven't seen the data.
Yeah, I'm totally speculating. I think it will be helpful, but to your point, we know that any of our antimicrobial drugs, our antibacterial drugs, our antifungal drugs, and our antiviral drugs, they work in combination with our immune system as well. And so it's very important to have a functioning immune system. If you don't, that could certainly affect the treatments. But I think it's important, if you do have a bone marrow transplant, talk with your medical team. We know Dr. McGurk and his team is always available 24 hours a day to answer those questions, and work with them to really find those best and safest practices for you and your family moving forward.
And I think that's a really big key. And I'm with you. I think the Pfizer drug is going to be effective. I think it won't perhaps be as effective as somebody who's immunocompetent, but fully, has a healthy immune system. But if you think of that drug plus vaccination and having everybody fully vaccinated, and then trying to wear your mask wherever you can, because masking plus vaccination protects the masker as well.
Absolutely.
And I think that's another really important point, that we have to realize that when we first talked about masks, we're trying to help save others. But the reality is, if you're fully vaccinated, the mask helps protect you a lot as well, because it diminishes the amount of virus you get inside of you. And so I think that masking plus vaccination really helps all of us.
Are you back tomorrow?
I believe I am.
Okay, then I can hold some of these. I've got a lot more questions, and they're really good. So I'm gonna, if you're here, I'll just hold on to these.
And I won't plan to sing until my voice recovers.
Thank goodness. Okay, sounds good. We'll be really looking forward to that.
My voice recovery. Yes, I thought you were going to say that.
Okay. Okay, so everyone who's been sending in questions, I'm going to hold off, and we will get to those tomorrow with Dr. Hawkinson and Dr. Stites. Last question is from Deb. Dr. Nawalanic, it is so hard to get out of my own head sometimes. I mean, that is a term we hear all the time. I'm just stuck in my own head, so I feel for her. Any tips on how to stop that when it starts up? That is a broad topic, but I have felt that way too.
Yeah. Okay. So, Deb, you're not alone. I wish you were. There are so many people that are struggling with this exact thing. So there's a moment where you start with the thought cycle. That's the crucial point for you to take a good deep breath, recognize that you know exactly where this is going to go, and that the more that you stay in your head, the less you're actively engaged in whatever it is that you're doing. If there's any sort of, like you have a bunch of problems swirling, I always ask my patients to make a list. Just write them down so you can actually see them, because when we leave them in our head, they kind of do this like revolving line where like one keeps jumping in the front, then the next one, and so it feels like there's more problems than there actually are. And when you make that list, look through it and think, is there anything that's an actionable item right now? Like something that I can actually do right now to deal with this? And if not, then you get to dismiss it. And what that looks like is replacing those worried thoughts with a statement of competence that, okay, I've got it. If there was something I could do right now, I would do it. I'm doing all I can, and I'm okay, and I'm going to get through this. So it's a little bit of thought blocking, a little bit of thought replacement, a little bit of relaxation so that we're not pulling back to that mammal brain where a lot of fear lives, and coming back to being your full human Deb self, that you can actually dive in and confront this to the best of your ability.
Yeah, Deb and Jess,
And Jess.
Dr. Stites, and Dr. Hawkins. We're all like that, right?
We all do it.
Okay, we
Gotta
all-
do
I'm-
it.
I'm thinking, I'm swirling around the idea of a Facebook detox.
I like it. You know what? You
Sounds
do.
great.
It's a recovery
Shall
group.
I do it? I think I
It's a
would.
recovery group. Let's do it.
Okay, it is a recovery. You will
That's
lead
it.
this recovery group. I'm Jessica. I have a
Facebook's
problem.
anonymous.
Yeah, exactly. Okay, so let's. We're going to get to our final thoughts. Again, we'll get to some of those great questions tomorrow. Dr. Nawalanic, thanks for being here today.
Thanks for having me. Good to be back.
Always
Good
a
to see you
pleasure,
guys.
man.
Yeah.
We try.
Absolutely.
Final thoughts, I guess, happiness is a goal. It's something that we all try to work for. It's not something to take for granted and think that it should just happen. When we would do well to try to identify what are the risks, what are the threats to our happiness, what are the things that we're not aware of that we're just daily, consistently signing ourselves over to. And essentially, the best tips I can give are to come back and recognize that this is the life you've created for yourself. There was a point in time where it was enriching, it was something that you wanted, and if that started to wane, it's about trying to reconnect with why you wanted it, what it is, how you got there, and give yourself credit for that. And if it's not what you want, if it's not the way you need it to be, then the onus is on you. You have the opportunity to change it and to improve it for the better for yourself. And you owe that to yourself, because this is your life. Do the best of it that you can.
So happiness doesn't always come naturally. It is okay to say you have to work for it. And
You got to
work
work
at
for
it.
it. You got to want it, and you got to work for it. And when you notice that you're not, it's up to you to steer the ship. And if you can't do it by yourself, then reach out. Licensed professionals are available. We are willing, able, dying to help. We'll do whatever we can. But ultimately, the burden is going to fall on you. And so you have to take those first steps. And like I end every single inpatient group with this: take care of yourselves and take care of each other. And that's it.
Great message. Thank you so much. Great advice. Dr. Hawkinson,
Thanks.
final thoughts.
Yeah, I mean, it's been a great show for me. I want to thank Dr. Nawalanic. I feel like I have to Venmo him now for this therapy session. So very good for emotional and spiritual and mental health. Thank you very much for that. Everybody continue to also get that medical health as well, and get your vaccinations.
Dr. Stites.
One of my favorite television shows, Ted Lasso. Football is life. Chiefs. It takes complementary football. You have to always have a great defense. The rules of infection control, vaccination, staying healthy, keeping yourself healthy, making sure you get the right sleep. Those things help you. And then you can go out in the offensive and get out in the world and go have some fun, right? Because let's face it, offense is fun.
It's fun.
But you've got to have a strong defense. It's all about the complementary, because we want everyone to live long and prosper. Star Trek Season 4 Discovery dropped. Awesome show. And I want to be around to watch all those shows.
Okay, so you've slipped in musical theater with Hamilton,
I did.
football, Ted Lasso,
I did.
and Star Trek.
I did.
Good for you.
It has been a complete morning.
It has.
this
You've
is-
touched on all your favorite topics.
Pass.
Wow.
That's right. Go Chiefs.
All right. Send us
Sporting.
your pictures and videos of your kiddos getting their vaccines. You can send those through Facebook Messenger to KU Hospital, or email them to the Medical News Network at kumc.edu. We will be showing those kids doing all the good stuff out there, get their vaccinations, and then we'll show those here on our show. So thank you for being with us today, and do not forget, you can catch our show anytime on our Facebook page and our YouTube channel. Coming up tomorrow, this is the first Thanksgiving mini families will be together in the last 2 years. So there's a lot of concern, not just about cooking your turkey, but a lot with COVID-19 and family members and all sorts of different viewpoints. So how the virus is impacting calls to the Poison Control Center and what you need to know to make this holiday as stress-free as it can be. So we will see you here tomorrow at 8 a.m. Have a great Monday, everyone.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.